Alexis St. Martin was a Canadian fur trapper who was accidentally shot in the stomach at close range way back in the 1800s. But unlike the vast majority of gunshot wound victims in the early 1800s, he survived. But his food fell right out of the hole in his side. And the story gets even wilder. So stay tuned and we'll go beyond the early days of learning about the gut-brain axis observed through a literal window into the stomach, what we know now, and how it affects you today.
I'm Dr. Vickie Petz Casper. I practiced obstetrics and gynecology for 20 years until I landed on the other side of the sheets as a very sick patient. When my own body betrayed me, I took a handful of pills to manage my disease and another handful to counteract the side effects. My health was out of control. Through surgery, medications, and lots of prayers, I regained my strength only to face another diagnosis. My doctor challenged me to make radical changes through lifestyle medicine. Now I feel great and I want to help you make changes that make a difference. Healthy Looks Great on You podcast takes you to many medical schools so you can learn the power of lifestyle medicine. If you're ready to take control of your health, you're in the right place. Whether you're focused on prevention or you're trying to manage a condition, I'll give you practical steps to start your own journey toward better health, because healthy looks great on you.
This is episode 178, More Than a Gut Feeling. What American surgeon Dr. William Beaumont did was questionable, but what he learned was amazing. The gunshot wound patient was far from home and probably was too frail to make the trip all the way back to Canada, at least initially. And he needed a means of support when he could no longer work. I mean, what does a fur trapper do when a fur trapper can't trap fur anymore? Well, this surgeon peeked into the gastric fistula and was mesmerized. I'm kind of mesmerized by the gut-brain axis too. And regardless of what you think of a doctor who took a man into his home as an indentured servant just so he could keep an eye on his gut, there's a lot we learned based on his observations, like emotions and stress affect the secretion of juices right into the stomach. And, of course, we also have Pavlov. Remember him? He rang the dinner bell and fed the dogs. The thing about dogs is that when the saliva starts flowing, they just let it drip right onto the floor. Eventually, he conditioned the release of saliva with the toll of the bell. No food, just ding, ding, ding. Turns out, emotions take a toll on the gut and vice versa. So we've really known about the connection between the gut and the brain for a very long time, but we haven't really understood it. We're more familiar with the foot bone being connected to the ankle bone than we are the gut-brain axis connection. I hope you're curious about the influence of this gut-brain connection. Let me see if I can trigger your appetite for more information. The gut-brain axis is obviously involved in digestion, which includes how the entire gut moves and functions. It can also impact metabolism, hunger, satiety, which is the feeling of being full and satisfied. It can affect food sensitivities and tolerances, as well as food preferences, all the way up to food cravings. And more on the brain side of the curtain, the gut-brain axis can affect mental health, altering mood and behavior. It can even make you more prone to anxiety or depression and affect your tolerance of pain and immune health. This is a bidirectional communication that is both affected by and affects stress levels. So if you've been wondering if your gut is messing with your mood, well, that's way more than a gut feeling. Imagine you're about to take a big test and your stomach just feels like it's in a knot. Or maybe your daughter is about to walk down the aisle and marry Mr. Perfect, and you've got butterflies in your belly. And gut feelings can be a punch in the gut, quite literally. Raise your hand if you know how it feels to totally lose your appetite during divorce, death, or other gut-wrenching seasons of life. But what if it works the other way around too? Like your gut is causing your panic attacks, moodiness, or brain fog. Hold that thought in your gut while we go to mini medical school. Don't get indigestion, stressing about your grade. I promise I'll make it simple and you'll pass with flying colors. We'll even celebrate your success with some foods that support the gut-brain axis, and that should calm your test anxiety. In medical school, gross anatomy, microanatomy, and physiology were all separate courses, but since this is mini medical school, we're just going to combine them. Let's start by learning a term, ENS, the enteric nervous system. There are about 500 million nerves that connect the brain to the gut, and they communicate back and forth with each other. And I just wondered, did they count them by hand? One time I counted, drew, and measured 10,000 neurons in the lab, and it took me all summer. But these neurons in the gut collaborate with the immune system, and they whisper sweet nothings to the endocrine system and crank out hormones like leptin. Leptin is the hormone that tells your body it's had enough, I'm full, I'm satisfied, I don't need to eat anymore. And ghrelin, which is the hunger hormone that says, let's get some more food going in here. We want those two to be in perfect balance, and you need a healthy gut microbiome for that to happen. It's also important in the production of cortisol, which is the stress hormone, but we need that for life, and serotonin, which is considered the happy hormone, as well as a precursor to melatonin, which is the sleep hormone. So you see how all of this interconnection is super important, and it's all part of the ANS, or the autonomic nervous system. And what that means is that the gut can send a signal to one of these nerves, and they can respond back without asking the brain's permission. It's just kind of automatic. And since the nerves in the gut can operate without total control from the brain, sometimes this neuronal network in the gut is nicknamed a second brain. I mean, who couldn't use a second brain to help you remember? Sorry, I forgot what I was going to say. Did you fall for that? Man, I wish my professors would have hit a big nerve like that to keep me awake during long lectures. Speaking of big nerves, maybe you've heard of the vagus nerve? Viva Las Vegas. No, wait. It's VAGUS, and what happens in the gut never stays in the gut. But the vagus nerve is in the big middle of it all. It is the main connection between the big brain and the enteric nervous system. It lets the brain know what's going on in the gut, and it sends signals from the gut to the brain continuously. Vagus nerve stimulation can be physical and also emotional, which explains why the gut-brain connection symptoms include irritable bowel symptoms like constipation and diarrhea, indigestions and sensitive tummy, chronic fatigue, stress, anxiety, depression, and brain fog. So maybe feeling bloated and anxious are related. And there are lots of potential reasons for this connection. First is inflammation. When there's an imbalance in the gut, we call that dysbiosis. And it can be associated with inflammation throughout the body, so it can possibly affect the brain and contribute to anxiety. And chronic stress certainly does not help this situation. So let's look at ways that we can heal our gut-brain axis naturally. Do you want to start improving on the brain side or the gut side? That's a trick question because they're so interconnected and you need one to help the other. So of course, stress management is crucial to maintain gut-brain equilibrium. You can use things like music, time in nature, prayer, deep breathing, and if you need more help, a counselor trained in cognitive behavioral therapy can help. Some people advocate gut-directed relaxation, like just putting your hand on your belly, feel the warmth, and visualize gaining control of your GI system function. But if you've been tracking through these episodes on gut health, you know that the gut microbiome is so important to the production of neurotransmitters. So for a healthy brain, you need a healthy gut. And if you missed any of those episodes, no worries. You can find them on my website at www.healthylooksgreatonYou. If you want to make changes, you've got to address stress and diet. Picture this. You skip breakfast, you drink coffee all morning, you have a tense meeting at work, then you scarf down a quick packaged lunch at your desk. That's a gut-brain horror movie. No wonder your digestion throws a tantrum later. Can we just all agree that was a setup? Managing stress and diet are super important to keep your gut microbiome healthy. But making lifestyle changes is hard. I think we can all agree on that. That's why I created Kickstart to healthy habits and lose belly fat in 7 days. I break it down and help you make foundational changes that build healthy habits for a lifetime, one small step at a time. But what lifestyle change do you want to make? Maybe you want to make dietary changes because that's most important when trying to lose belly fat or nourish a healthy gut microbiome. You need to eat a balanced diet that's rich in fiber, probiotics, and omega-3 fatty acids. Again, go back and listen to that episode if you missed it. And although it would take a lot of exercise to lose belly fat, exercise is important. Physical fitness helps your health. It also helps manage stress, and that's important for a healthy gut. So let's talk specifics. Researchers are continuing to investigate the link between the gut microbiome, the immune system, and the risk for developing things like obesity and type 2 diabetes. We already know that gut health and mental health are related, and there's an endless supplement industry to try to improve gut-brain health. But the most effective natural way to control gut-brain axis anxiety is through your diet. So let's do a quick gut check. How do you feel after a really stressful day? Bloated? Brain fog? Craving carbohydrates like a toddler on Halloween? Pay attention. That is your gut-brain axis chiming in. So what's one thing you could do today to ease that tension? Take a walk or eat a veggie-filled meal? I have several resources to help you. If you're like me and you get home on 2 wheels and wonder, what in the world am I going to fix for dinner? So you just hit the easy button and you go out or you order takeout, then check out my free pantry guide. It's on my website and there's a link in the show notes too. But there are 10 things that you can keep in your freezer and 10 that you can keep in your pantry so that even if you don't have a plan, it's no problem. You can throw together a quick, healthy meal in no time at all. If you know how to eat healthy, but you can't seem to stick with a plan, then check out Kickstart to Healthy Habits. This 7-day mini course will help you lay the foundation for habits that stick. And the main habit to consider for your gut microbiome, belly fat, and your mental health is an abundance and variety of whole plant foods. And reduce or eliminate those inflammatory foods like sugar and saturated fats. And think fiber, both soluble and insoluble, to promote gut health. These are found in plants along with those good prebiotics and probiotics in fermented foods like sauerkraut and kombucha. Most of your body's serotonin, the happy hormone, is not even made in your brain. It's made in your gut. So the next time you reach for some comfort food to boost your mood, your gut might be the one calling the shots, not your brain. And please, avoid unnecessary antibiotics as those immediately disrupt the gut lining. If you need them, take them, and if not, skip it. Because healthy gut permeability can mean a healthy mood, a healthy brain, and overall, healthy looks great on you.
The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.